Hi everyone, Debbie Deno here. And so we are going to continue on in day two, talking about some of the hormones that can get out of balance for women. So when we start to think about the sex organ, the organ that's responsible for making many of our hormones in women, that is going to be our ovaries. And I know when I was going through school in undergrad, I found it so interesting to learn that as a woman, I am born with all of the eggs in my ovaries I'm ever going to have, which is really different from men. Men can continually, because of the action of testosterone, as long as there's enough testosterone, they can continue to make sperm throughout their reproductive life. Okay, so that's why men can father babies well into their 70s, their 80s, sometimes more than that, depending on their testosterone levels. But us girls, fortunately, we're only born with a certain number. The number's really high, though. If I remember right, it was well over 1 million eggs. And by the time we reach puberty, where we can start to have a menstrual cycle, we still had 300 to 400,000 of them. So that's a lot. But even obviously throughout our life, we're not going to use anywhere near all of those eggs. So as we are exposed, this is one of the things that I think is so critical for the health of women, is that as we are exposed to compounds, good or bad, they can possibly affect those eggs that we have inside of us. So I think especially I'm excited about talking about hormone balance, because especially when women are in their reproductive years still, and they are still wanting to have children, anything that we can do to decrease toxicity and balance their bodies, I think that they'll have a much greater chance of being fertile and having great little babies. So let's move into, in general, though, what hormones we're talking about for women. We're talking about estrogen and progesterone predominantly, but also testosterone. We have balance of those three major types of hormones, and estrogen and progesterone are the dominant ones, though, for us. So what does estrogen do? Well, estrogen helps develop our breast tissue. It helps develop the eggs. We see a couple of different hormones developing the eggs within our ovaries so that they can be released and ovulated. But estrogen, especially, what it does, in addition to creating the proper breast tissue so that we can nurse a child, it also helps thicken up the lining of the uterus, that endometrial lining that we use. It's kind of like that fertile soil in the garden. Well, this garden is for a fertilized egg to deposit and grow. Okay, so if estrogen is the fertile soil, progesterone, its job is to maintain. It's like the gardener tending that garden, and progesterone maintains the thickened lining, which normally what women do is our estrogen levels rise when we're not pregnant. Our estrogen levels rise. We've released an egg, and our lining is getting nice and thick. Nothing happens, so our body gets a signal and estrogen levels drop, and we shed that lining and we have a menstrual cycle. Okay? Well, progesterone keeps everything high. It keeps that pregnancy, it helps maintain that. Estrogen is also responsible for a lot of different co-reactions in our body, and one of them that fascinates me quite a lot is that estrogen acts on the intestines to affect the absorption of certain compounds, predominantly calcium. So when our estrogen levels begin to drop as we prepare toward menopause, but also not naturally if we have some imbalances, we have some irregularities and not good balance of estrogen, we can see that maybe even women that are younger can start to have issues where they're not absorbing enough calcium, which can affect muscle tissue. It's a cofactor for lots of chemical reactions, and of course the health and strength of our bones. Okay. One other thing that progesterone does, we said it helps maintain. It and estrogen, when it's in balance, it helps create a clear mind that helps us be more focused, more clear. It also helps encourage libido. So when those compounds get out of whack, oftentimes women are going to say, I'm tired and I've got brain fog and I just can't remember things. and they really have a tendency to feel overwhelmed. All bad. So, some other symptoms of our hormones getting out of balance is maybe the digestive tract isn't working well, so we experience problems with bloating and gas and irregularities there. I already mentioned it can affect mood, and certainly we maybe you don't know. Many of us know somebody who, as their hormones get out of balance, they have mood swings. Maybe they suffer from anxiety, depression, and it's made worse during those times when their hormones are fluctuating around their cycle. It, of course, can create infertility if we can't thicken that lining and have a proper foundation, or if our progesterone levels drop, which is a common scenario, and we can't maintain pregnancy, so we'll experience infertility. A couple of other things that we see with hormone imbalances in women is just like men, when their testosterone level changed, as women, as their estrogen and progesterone levels dry up, one of the things we know is we experience a drying. We tend to begin to lose moisture. Our skin thins. We've got less of that nice, women, we're nice and soft and fluffy in all the right places. Well, as we age, our skin thins and that fat layer there thins. We start to put fat around our tummies, which nobody likes, and it's very resistant fat. It's hard to get rid of. So that can affect our weight. It can affect even our blood sugar. As fat cells, they give off an estrogen-like compound that unfortunately can affect our blood sugar. So we also see, maybe diabetes, prediabetes being more common too when our hormones start to get out of whack. So enough of that negativity. What I want you to do in the comments section is, if you feel comfortable, maybe tell us some of the, if there's been any symptoms or struggles that you've had. Most of our class attendees are women, not all of them. So maybe a situation where you would have liked to have had some support, or if there's something that you learned today about one of the hormones that you didn't know, feel free to comment about that. Our next video, we're going to talk about some hormone disruptors, and I think you'll be surprised at all the things that are in our homes and in our surroundings. So we'll talk about that next.